Good morning, everybody. Gender inequalities and the dynamics of disease are inextricably entangled. We won't defeat the three biggest epidemics affecting humanity, AIDS, TB, and malaria, if we don't recognize this reality. Take HIV/AIDS. Huge progress has been made in the fight against HIV, with AIDS-related deaths cut by 40% since 2000. One driver of this success has been the progress in treating pregnant women, protecting the mother, and preventing transmission of the virus to the child. In 2000, less than 1% of pregnant women in Eastern and Southern Africa were receiving such treatment. By 2010, it was more than 60%, and by 2017, over 90%. Yet, even this success story conceals a shocking failure to protect women's rights. In the early years, the focus was almost exclusively on prevention of transmission of the HIV virus to the child. Many women were only given treatment long enough to keep their children HIV negative. As a consequence, far too many women died. This failure was belatedly addressed. However, today we continue to see the effects of insufficient focus on women and their rights. AIDS-related illnesses are the leading cause of death among 15 to 49-year-old women worldwide. In Sub-Saharan Africa, adolescent girls and young women are twice as likely to be infected with HIV than their male counterparts, and in the worst hit countries, up to 6 times as likely. Indeed, in the time it takes me to do this presentation, 3 young women will be infected with HIV. The HIV incidence rate for adolescent girls and young women in Southern and Eastern Africa fell by 16% between 2015 and 2017. But we need to do much more, not least because the demographic trends. If we don't achieve a significant reduction in infection rates, we face the possibility of a 42% rise in absolute numbers by 2030. We cannot allow this to happen. It would be an absolute disaster for the individuals and for the communities in which they live. The challenge is that preventing HIV infection among adolescent girls and young women is not some narrow biomedical problem that can be solved with some wonder drug. High HIV infection rates are the symptom of deep gender inequalities, sexual violence, educational disadvantage, economic disempowerment. When I talk to young women in Africa, HIV actually isn't the top of the list of worries. They want to talk about staying safe from violence. They want to talk about preventing pregnancy. They want to talk about getting a job. So the Global Fund has been pushing beyond our biomedical boundaries, taking a broader, more holistic approach, paying girls to stay at school, supporting programs on gender-based violence and on comprehensive sexuality education, providing access to condoms, helping girls and young women become economically independent. Take Prudence, a young woman I met in South Africa, who was inspired by a program on entrepreneurship to begin making mobile phone and laptop cases. We're working with a wide variety of partners, governments, women's rights organizations, schools, and families. Through Her Voice, dozens of grants have been given to community organizations of adolescent girls and young women to ensure their voices can be heard. We will only succeed when girls can influence, shape, and prioritize the programs that affect their health and their lives. Several Her Voice ambassadors have joined us here in Vancouver. Beverly from Kenya, Brenda from Cameroon, Grace from Malawi, and Sibu from South Africa. These amazing young women are championing the rights of women and girls in their countries. And if you have a moment, I really encourage you to connect with them. I guarantee they'll inspire you. But it's not just adolescent girls and young women who face increased risk of infection. Marginalized populations of women, such as sex workers, women who inject drugs, transgender women, are particularly vulnerable to HIV. HIV incidence is 10 times higher among vulnerable sex workers than among the general population. Tailored interventions, ideally designed and delivered by people from the communities, are essential. So we work with affected communities of women in dozens of countries to overcome criminalization, discrimination, and stigma. For example, in Zimbabwe, we work with sex workers to reinforce safer sexual practices and uptake of HIV prevention services. HIV is a potent example of the link between gender inequalities and the dynamics of a disease. But TB and malaria also provide evidence. Barriers to access, stigma, lack of power drive disease and ill health as surely as any pathogen. So we need to shift, we need to tackle the barriers, remove the stigma, shift the power. And if we want to achieve the goal of ending the epidemics by 2030, a goal that's within reach, if not firmly within our grasp, we need to step up the fight. The mandate of the Global Fund is both big and, in some senses, quite narrow. Our goal is to end the epidemics of AIDS, TB, and malaria, the 3 biggest infectious diseases affecting humanity, and do so by 2030. Yet we will only succeed in achieving this objective if we confront gender inequalities in healthcare head-on. And frankly, we will only achieve this if women are in the position to make decisions for themselves, in delivering health services, and in making policy. And this won't happen by accident or automatically. It requires leadership by women, and it requires men like myself in positions of some influence to know when to enable, when to be a partner, and when to get out of the way. I am committed to playing my part in making this happen. Thank you.
Thank you very much, and really appreciate you as a man ally and really working on these issues that are still affecting many, many women around the globe. And one of the questions that I'd like to ask you, and you touched upon it in your closing, here, is how are you going to use your power going forward to continue this work, and how others can help you to more use your power on these topics?
2 very specific things. One is the Global Fund is committed to reducing infection rates among adolescent girls and young women in the 13 most affected countries by 58% by 2022. So come back and
I'll hold you to that.
Hold me to it.
I'll hold you to it.
And the partners' point, we can't do this on our own. We are an institution with great strengths in certain aspects of the problem, but we need civil society, we need community groups, we need partners in education, we need other players to work with us to make it happen.
Definitely a solutions-based approach with partners, because we can't all do it alone. Thank you so much for your great presentation, and I hope partners can get in touch with you to really work through this.
Thank you very much.
Thank you.